Very good evening to one and all. Welcome back to the today's session. We welcome you, Dr. Rajiv sir, today's speaker sir. We welcome you all the participants. So today's topic will be regarding the importance of observation in practice. Coming on to the regarding the Dr. Raju sir. Raju sir is a associate professor from the Department of Organon of Medicine in Aarihant Homoeopathy Medical College. So we welcome you, sir. We welcome all the participants. Over to you, sir. Session is all yours, sir.
A very good evening to one and all present here. I'm very happy to be with you all today and to speak on my topic, that is the importance of observation in practice. No matter how many diagnostic tools shall be available at the hand of the modern practitioner, still the bedrock for the physician's art still remains the direct interaction with the patient. And that is nothing but the history taking and a thorough clinical examination. So the role of observation comes into play here as the practical skills that are needed to detect the clinical signs of the disease. So the objective of my session is to demonstrate the importance of observation through case-based studies. So there are initial observations that one can make. That is, we have to look into the site of the pain, look for the presence or the absence of physical signs that will confirm a disease or that will refute the differential diagnosis. Look for any abnormal pattern of breathing. Look for any scars. Scars may be like cut marks which may be found on the forearm of the patient, which will give you an idea of the psychological uh, picture of the patient. Next thing is look for the demeanor and the attire of the patient. So even this demeanor or the attire gives you a lot of clues about the personality. That is the patient's physical state, his social circumstances, the state of his mind. For example, if you see somebody who is having a recent weight loss, he may appear as if he is wearing baggy type of clothes or loose clothes. And actually, this is a sign of emaciation. Okay. The other thing is, suppose you want to identify signs of self neglect. Now, this is commonly seen by the attire of the patient, usually found in the drug addicts or in alcohol dependent people. A patient who is suffering from thyrotoxicosis will often come dressed for summer, so much he is covered due to the heat intolerance. So actually he is a misfit. For summer, normally people will come with light clothes, khadi clothes, which will be easy for to uh, bear the heat. But thyrotoxicosis patient will be a misfit, just like how Swarrnim will be coming, overdressed in summer weather. Next thing is look for deformity. Okay, now deformity can also be identified. Uh, you have to look for post injury also you can come up with deformities. You know the famous popular joke of three consultants were trying to compete with one another, and a patient was limping. So one fellow started looking at the orthopedic component of it because he was an orthopedic postgraduate student. Another fellow was doing neurology. He started looking at the neurological aspects of it. But ultimately, when they inquired with the patient, it was a simple case of shoe bite. So post-traumatic also you can come up with a limp. Okay, not necessarily it has to be a pathological condition. So in deformities, what we will look for, we will look for nerve palsies. Maybe there is an ulnar deviation where the metacarpophalangeal joints are deviated in a certain way, like found in rheumatoid arthritis. Or you will see the thenar muscles will go for the wasting in carpal tunnel syndrome due to the compression of the median nerve. So, or you may feel Duprin's contracture. This is the fixed flexion deformity, often involving the little finger or the ring finger. Or you will have thin, long fingers as found in Marfan's syndrome. Besides this, you have to also look at the gait. Gait also gives a lot of evidence in terms of pain, in terms of weakness, like a hemiplegic gait. Hemiplegic gait is after stroke. Ataxic gait found in cerebral diseases. Even if it is a case of a motor vehicle accident where the cerebellum is involved, you will find that post-operatively and the rest of his life, the patient may be suffering from ataxic gait. Somebody walking little steps at a time could be indicative of Parkinsonism, or you may find chorea. Then you have to think of Huntington's disease. The next thing is we have to also look for color. Now in color, what you will look for? You will look for peripheral cyanosis. That will be found in the nail bed, or you may find that tobacco stains will be found on the fingers. This will be the color element of it. Look into the nails. Okay, so like for example, for clubbing, or whether there is pitting over the nails, because that will also help you in the diagnosis. Now the next thing is facial expression. The most evident thing that whenever we meet a patient or any person is the face. Lot of features are identified on the face. Like for example, you find the poverty in expression in the Parkinsonism. You will find a startled expression in hyperthyroidism, or an agitated expression. Then apathy with poverty in expression, poor eye contact may be signifying a case of depression. Or look at the next one, apathy with pale skin and as well as puffy skin may be a sign of hypotension. So I will be showing you some cases wherein we will be able to see a few of these. So now we go to the case one. Now, this is a 59-year-old patient. Okay. Now, in December 2024, accidentally, this skin lesion was discovered by his wife on the left ankle lateral side. At that time, it was restricted to only one leg. Gradually, it shifted to the right ankle as well. So he had gone, when it was restricted to one leg in December, he had been to an allopathic doctor who thought of the diagnosis contact dermatitis. So he advised him to change his sandals. Now, what happened was, after a few months, it started spreading on the right ankle also. And then he went to a medical college dermatology OPD, where the consultant had diagnosed psoriasis for him and prescribed some skin ointment. He contacted me over the phone and I told him, don't apply anything, let me have a look at you first. So on 3rd of February 2025, when he came to my clinic, I had a look at the lesion. There was no itching, there was no scaling also. Rather, what I observed was that the patient was reserved by nature, and the left eye was constantly watering. So actually, what diagnosis was advised to this patient, my diagnosis was not matching with the consultant diagnosis or the diagnosis of the allopathic doctor. Because the atopic dermatitis, it could not be, because there is no itching. Atopic dermatitis location is there, but itching is missing. For psoriasis, the scaling is missing. So my diagnosis was as not contact dermatitis but atopic dermatitis, and related with stress, because during the interview he told me of the feeling of injustice and unfairness that was done towards him by his family. Another incident also he mentioned about the family. In December month, his niece got married, and during the marriage day, he had a role to play. He had to sing for his niece's wedding. And suddenly, one day before the event, suddenly he lost his voice. And then he had come to me, and I had given him vitamin C tablets. mixed in warm water, which restored his voice. So this is another aspect. Okay, so this is the skin lesion. And this is what happened after the medicine, okay, on in March month, 24th of March. Okay. How was the totality made? Reserved, injustice cannot support, a conscientious person and with an anxious temperament, and lacrimation left eye, which you will find in the Kent's report. So this is a case of atopic dermatitis. What were my observations for this case? So left eye is tearing constantly and no foreign body in the eye, no inflammation, no infection, nothing. So this is actually a distal concomitant, which helps us to come safely to the prescription. Now, the skin lesions, as I was examining them, redness was there, but itching is missing. The two diagnoses that were given to him before, contact dermatitis and psoriasis, they were also, not, they were contradicting my diagnosis. That incident of sudden nervous loss of voice in December, all these are actually symbolic of the contradiction that is present in this patient. So on the basis of this, as well as the totality, if you look at it from the contradiction point of view, or you look at it from the totality point of view, both are indicative of Ignatia amara. So he was given a single dose of Ignatia amara in a one glass to drink, and that's the result which you have seen already yourself. Okay, all the skin lesions cleared up. Now we are already in July and no reappearance. If it is psoriasis, it will reappear. Okay, but no reappearance. Patient is very happy, and patient took a lot of time before disclosing that he had been all right. So he sent me those pictures and said that look at my rejuvenated skin. Okay, so this first case, left eye tearing, this is what helped me to arrive at the diagnosis. And after 20 days of Ignatia amara single dose LM potency 0/1, the patient informed me that after 20 days automatically the lesion started clearing off without any external application. This case is not tempered by any ointments or any steroids or any treatment. And he told me the skin lesion on the right side, what had come last, went on first, and that's how the clearance happened. And this is how observation helped me to crack this case. Now we go to case number 2. Case number 2 is actually an incident which has happened in front of me. 52-year-old male. Now actually this man had come from his native in the month of January, cold weather, and the previous day he was feeling little uncomfortable, some sort of a GI upset because he was constipated, and as a result of which he was not able to sleep the previous night. So next day when he came, he was looking very exhausted, he was feeling very chilly, and he told me that the coldness is felt in the joints. He wanted to rest or sleep the entire day. He wanted to be in the sun. It was a sunny day. He told me that I want to put a bed out in the sun and sleep outside. Naturally, he did not do it, but this is what his wish was. So previous day, naturally, he has not slept 4 a.m. and not able to do any type of intellectual work. Okay. So as the day was passing by, I saw that this man is not eating anything, not drinking anything. He's sitting on a chair and he kept a stool in front of him. He kept his legs over it. Okay, like how the boss would do. But his legs were falling off the stool. His hands were falling off the chair. He was tilting. Luckily, there was a table, so he had a little bit of support. And by 4 p.m. in the evening, I saw him grunting. So immediately, I brought the sphygmomanometer and checked his blood pressure. It was 90/50. So if we spoke to him, he was arousable, but again, he would fall asleep immediately. Now, what I observed, he is hanging down from the chair. His sitting on the chair, but his body is hanging, not able to even sit properly. Nose was dripping. He was taking a napkin and wiping it off, unable to express his symptom, and thirstless. He was afraid to eat. He did not eat also anything. I saw him walking in the morning. He was walking, he was so weak. He was walking like a drunkard. You know how there is no stability. So, the clinical diagnosis, hypotension. Because in hypotension, you find low blood pressure, 90/50, confusion, upset stomach, fainting, shallow breathing. Okay. And it is hypotension with influenza because he had weakness, he had fever, he was pale, but sitting in the sun, his face had turned red. Okay, nose stuff, sore throat, headache, and no taste, sneezing. So hypotension with influenza, this was the diagnosis. Now after the homeopathic remedy, what happened? Next day homeopathic remedy was given. The next following day he came and he was fully wakeful. His expressions returned. He was able to stand, no vertigo, thanked everyone. So what was done, I referred BBCR repertory for the strong general modality that was present in him. Sun ameliorates, that is the heat of the sun as well as light of the sun. In BBCR, only one remedy is there, conium. Then I looked in bogus synoptic key. In bold letters, it is given progressive debility, sudden sick and weak. When he had constipation, he had gone to pass stool, he strained and he fainted, nearly fainted and fell down in the bath. Faints at stool. One observation that I had made while watching him was he had sweat under the eyelids, sweat under eyes, and the modality letting parts hang down. Okay, that is the limbs and the head from the chair, which were the observations. So, a person who's generally charming, who's very upright in all his things, okay, and now the whole picture suddenly changed. It started with this constipation, influenza, and now hypotension. So what was the prescription? Conium maculatum 30. Now, a few more reasons why conium maculatum. If you look in boric, you'll find this difficult gait. Then worse from mental exertion, worse physical exertion. If you look in Allen's keynote, no inclination for business. So even though patient is sick, still they will wear good clothes. Why I chose conium? It's a circulatory medicine and no stool. Okay, so rectum relaxed, not working, no taste. Okay, stomach relaxed, not eating, not drinking. Now muscle relax, ataxia, difficulty in walking, wants to be alone. And the other very peculiar thing was, although he's so sick, so much hypotension, not asking for help, he is, still he is aware of who are the people who are around him, even in that drowsy state, that state of alertness. This is a very peculiarity of the conium people. Even if they are deep in sleep, they are very much aware of their surrounding. Now, another exercise I did to, figure out the special modality that I found in this case. What was that special modality? The special modality was the better in the sun. So I looked into Clark's dictionary. Under conium, you'll find chilliness with desire for heat, especially of the sunshine. So it's not just any type of heat, especially of the sunshine, which exactly how my patient had for this. And that's how conium restored him immediately. Next day, his blood pressure, in fact, the medicine was given after 15 minutes, blood pressure improved. He went home alone. Next day, the blood pressure was 120/70. Okay, the constipation also improved, and overall, the patient was free from headache, free from vertigo, and all other complaints. So this is another prescription where the observation helped me to make the prescription. So actually, This case, we come to understand that we have to listen to your patient. The patient is telling you the diagnosis. Why he lifted his legs and kept them on the stool? Actually, this is basically the recovery position that is given to the hypotension patient. Even though we are sick, the body still guides you, makes you to adopt certain position which generally you will never adopt, so that there is some amount of stability created. So that element where he's trying to put his leg on the stool, legs are falling down, it was an attempt of self recovery from the body side. Okay, and this observation help you to make the diagnosis of hypotension. Okay, so William Osler always says, listen to your patient. He is telling you the diagnosis, and listening need not only be from the ears. Listening can happen even from the eyes. That is the observation. Now we go to the case 3. This is a child now, 6-year-old boy. Actually, his mother called me up saying that my child is not well, he is wheezing. I just want to bring him and show you before things get worse. So he was brought in. The moment this child came, uh, in my clinic, I have a machine to check the strength, it grades the strength on the through the wrist. So he came, can I check my strength? So I gave him that machine. I took advantage of that scenario and I auscultated his lungs. So what I found was there were coarse rattles during inspiration. Then the child went to the other side and he sat down. Then I observed while sitting down, he is not able to, keep himself up. He is, falling off the chair. This was alarming. The chairs which I kept for my patient, they don't have armrest. So he was literally falling off the chair. I could observe the distress in his breathing. His face was irritated. Mother told me since last 2 days he's become restless. He had fever, but the maid gave him Imol syrup and that fever disappeared. Then I asked the mother appetite thirst. Now his mother working in the office and that to government office and that to working for the government, and those days assembly was going on. So the mother had a responsibility of giving the answers to the ministers. So she was too occupied. So she doesn't know whether the child is thirsty or thirstless. She has to depend on the maid. I observed that the child's lips are red, especially the lower lip. And when he came in, he told me, I'm feeling cold. Then I switched off the fan, which never he will say. Normally he is a hot patient. But now he came and he told me, I'm feeling cold. I switched off the fan. And these are the observations. So another thing, what he told me, I'm feeling sleepy. I heard him cough a little bit. It was a loose cough. So there was a mucus accumulation, but no expectoration. Then suddenly he told his mother, I feel like vomiting. So his mother took him out of the clinic and then he vomited. Then he came inside. I saw his eyes were red. And I asked him how you're feeling. He said, Doctor, I'm feeling sick, he told me. After 1 minute, again he told his mother, I want to vomit. So mother took him out. And again he made a lot of noise while vomiting, a lot of retching. So I went out and I just checked what he has vomited. It was little froth was seen with the mucus. So after he came inside, then I asked the child, now how you're feeling? Then he started saying that I'm feeling better. So once again, I confirmed. Then I asked him, what's the taste in your mouth? He said, bitter. Once again, I confirmed, and it was clear that he's relieved after vomiting. So cough, relieved after vomiting. So this is the child. Then I just quickly checked his tongue. It was a clear tongue. Okay, so immediately I made the remedy diagnosis. I gave him the medicine. The child, as he was leaving my clinic, I told him, if you are not feeling well, you can stay at my house. He said, no, I'm feeling a little better. Then his mother told me that while they were traveling by the car, his wheezing also settled. I had given 2 more SOS doses of the medicine, which were not required. Just that one single dose of the medicine helped to relieve him. What was the medicine and how we arrived at the medicine? So totality was made chilly, restless, irritated, the concomitant of chill with wheezing and gastrointestinal involvement. So this case, is having rich concomitants, chilliness with wheezing and gastrointestinal involvement. Then retching with vomiting triggered by the irritation of pneumogastric nerve, and this happened in the initial stage of congestion. Clean tongue despite the vomiting and better after vomiting, cough better after vomiting. So this was my totality. So repertorization, I have taken BBCR again and chill with concomitant of vomiting with expectoration. All three I got. And cough, vomiting ameliorates. Vomiting ameliorates the cough. So only one drug was covering both the rubrics, and that too having a clean tongue. You have seen the picture yourself. This is the actual description of Ipecac. But why not antimonium tartaricum? Because antimonium tartaricum also has got a lot of mucus, but antimonium tartaricum is for the later stages when the lung fails from the paralysis, whereas ipecac comes for the initial stages of congestion. Antimonium tart, no expectoration, whereas ipecac, much expectoration. Antimonium tart, hot patient with thick white coated tongue. Ipecac, chilly patient with clean tongue. And if you look in Kent, Kent says for antimonium tart, slow pace. And mostly we don't find violent symptoms. Whereas for Ipecac, he talks of bronchitis with coarse rattling, that too in the first day. So you see the rapid pace. This child also fell sick after having, ice cream for his brother's birthday 1 day prior. And then immediately he comes up with this fever and this wheezing. So quick, rapid pace, which is not there for antimonium tart. So this was the understanding why Ipecac was chosen. So what is the prescription? Ipecac LM2 was given single dose, which cured this patient. Okay. So after this, he was better for a long time, and then he was given his constitutional remedy. Okay. And for last 10 months, not a single attack of bronchitis, and patient is doing well. Now, even in this case, it was an observation that helped me to prescribe Ipecac. The observation of the type of the vomitus, the modality of amelioration after vomiting, cough amelioration after vomiting, the tongue, which is a clean tongue. So these observations help me to arrive at the prescription of Ipecac. Now this is a warning, what I have put here, that when we must use observation. So our general protocol is what? We take a complete history, then we go by the characteristics, by forming the totality, okay, and arriving at the drug. Now there will be circumstances where you do not get a complete history. For example, in comatose patients, for example, maybe in pediatrics, then you may use observations, the behavior, of the posture, of the gesture, of the speech, that will help you to select the drug. So actually, this topic of importance of observation does should not encourage you to break down the concept of totality of symptom. Totality of symptom come first. When totality is not possible to erect, maybe because the case history was not possible, then you will go by the observation. Okay, observation will not overrule the totality of the symptom. Understand? Okay, now here we see that there is a lady who is reading a book in the waiting room. This is also an observation. And this observation is an observation for the patient, about the patient. What remedies we can think of? So there is a set of remedies which are, craving for reading. That even this 5-10 minutes of waiting space also, they will carry the book, they will read. It's an observation which will help us to understand the constitutional picture of the patient. Okay, so these are the following remedies: carcinosin, natramure, Silesia, Calcarea. These are lovers of reading. Okay, so it will help you. Observation is going to help you to think of a set of remedies. Now, this is another experience. Some patients will like to hug their therapist. Now, generally, in our culture, we do not encourage hugging. If the therapist starts hugging the patient, there will be a big molestation case which will be appearing on the newspaper the next day. But there are some constitution who like to be hugged, who like to be carried. So when they are coming to their therapist and they're touched by the therapist's counseling or by the advice or the correct diagnosis, or maybe the patient gets cured, you will experience that even they will give a hug to the therapist. So inclination to hug. So this also, there are remedies. So two of these remedies are phosphorus and pulsatilla. Okay, there can be many others, but these are the most prominent ones. And through the observation of this phenomena, you may arrive at the thinking of these two. Okay, later on, the chief complaint, the modalities, concomitants may help you to select or rule out either of it. This is something that we always do. Okay, handshake, right? There are many type of handshakes. When we talk of handshake, don't look at it only from the homeopathic point of view. Here I have given you examples of the type of handshake. If it's a dry hand and the hands are hot, then you may think of two remedies prominently: sulfur and nux vomica. Then if the hand is limp and cold and clammy, then you may think of calcarea carb. There are people who will shake hands with you with both the hands and press your hand so hard that you will wince out of pain. Dominant personality. Okay, you may think of lycopodium. This is our homeopathic aspect of thinking. You should also be looking at it as a medical doctor. Like when you have a patient who is having a handshake which is cold and sweaty, it may be indicative of an anxiety, state of anxiety. Or you have another person who is having a handshake which is dry and cold, not sweaty, cold and dry, then it may be a sign of Reynolds phenomenon. You may have another patient whose handshake is hot and sweaty, then you must rule out hyperthyroidism. Somebody will have large and fleshy and sweaty hands, then you must also check for acromegaly. Another person may have dry and coarse skin. Dry skin, coarse skin, you think of hypothyroidism or a manual occupation. Maybe he is doing a lot of manual type of a labor work. Suppose you have someone who handshake with you and his hands are not able to free, delay in the relaxation of the grip, then it may be a case of myotonic dystrophy. So even a handshake can take you to the diagnosis, and even a handshake can take you to the remedy. So you have to be very observant of this aspect as well. Patient's complexion. If you look at the complexion of this person's face, dirty. Sometimes this type of, not necessarily face, it may be on the hands also. Okay, there are drugs for this. Swarrnim, petroleum, or maybe the skin is cracked, graphitis. Dark skin, constitutionally they are dark, dark complexion. Nux vomica, ignatia, muriatic acid, coffea. So even this observation can help you, to arrive at a certain group of remedies. So this is how observation will also help you to prescribe. Nature of hair. I've shown you only one type of hair here. There can be, I remember seeing a patient who had hair which was like the nylon rope, thick, hard to break, or maybe the color of the hair, premature graying of the hair, okay, like happens in lycopodium, or limp hair of natramure, or fair and blonde hair of belladonna, pulstilla, spongia. These are actually a constitutional type, or someone having oily hair. I've made a prescription based on oily hair. The hair was not oiled, but it was looking as if he has oil with a lot of oil. Okay, I think so. Muxol has got this symptom. Then the height of the patient also. Fast growing people, acid force, calcarea force, or tall and stoop shouldered. Sulfur can be, or phosphorus also can be, or tall and obese, Sina, tall and thin, Coffea, calcarea force. So even the height will give you a clue to the constitutional type. So not only physical observations, even the way the patient, respond to you. This will also help you to arrive at a certain diagnosis. When somebody is reluctant to engage in a consultation, for example, then it can be a case of underlying depression, or it may be a case of anxiety, fear, anger, emotions. So one of therapist has to recognize the importance of emotions. Some abnormalities can be found in the character of the speech also, like slurring speech due to alcohol, or dysarthria due to motor neuron disease, or maybe a hoarseness which may be due to the recurrent laryngeal nerve damage. Slowness of speech which may be found in myxedema. Okay. Now also I will show you how this will help you to look at the from the homeopathic angle. So what brings you to me? This is what we generally ask our patients. If the person says that I was researching on the internet, now I am qualified to tell you that this is my diagnosis and this is how the treatment should be going about. So you are talking to a person who knows it all, who is theorizing, who is haughty, and who has abundance of ideas. So this observation of his mannerism has brought you to the sulfur remedy. Another person may be somebody who's trying to control the whole situation out of the sense of shame, or maybe out of the sense of pain. So now we are dealing with the proud natramir who doesn't want anyone's consolation, doesn't want anybody's help. So another observation that help you to arrive at the simile. Or you may be having a third person. She'll never give you a clear-cut answer. Will take you around the bush. You ask something, may ask you in return. So very cautious and incomplete in their reply, because they don't trust neither the therapist nor the remedy that he's giving. After you prescribe, they will even ask you, is this remedy not going to hurt me? No. Or sometimes this type of people may be quarreling with you. And you may see certain observation also that they are sweating only on one aspect of their body, that is the neck. That will take you towards the lachesis. Once you give them lachesis, their life will become peaceful. less quarrels, peace at home, peace within. Okay, so observation may help you, okay, to give the correct simile. Now, sometimes even the dealing of your patient with your receptionist will help you to also come to a certain good understanding of the case. What is that understanding? Somebody will be very demanding for an immediate appointment. No, no, I want an appointment because they feel they are more important than anyone else. And if there is an assistant doctor who is taking the entire case history, they will refuse. No, I will talk only to the main doctor, to the head. That will also give you a fair idea of a platina person. Or another person, okay, who is, they will deal with the reception as if they are going to die on the spot if you can't take them right away inside. Okay, this will be the anxious arsenics. There can be some people who will, fake a chest pain just to go inside first. Then you will have to think of cunning remedies like tarantula. There are also others who are going to be, very close to your receptionist out of friendship. Okay, then you think of phosphorus. Okay, who longs for relationship. Or some people or your patient may be clingy to the receptionist. Then you think of pulse stealer. Now there will be some men who will also try to date with her. Then you think of lycopodium. So you're making an observation of how the patient is behaving to the people around you in your clinic. And that's giving you an idea of how he goes about in his life. So this observation also helps us, to make a certain understanding of our patient. Or someone who wants music even in the waiting room. But again, now here differential will come with the type of music. Sad songs, natramure. Holy music, then aurum metallicum. Okay, so uh, even these finer things are important to arrive at the understanding of the medicine. Then you see the patient, how he's living his life all alone, wants to be left alone, grouchy. Okay, even that will help you to understand. Bryonia is nothing but dryonia. Dry from all the excitement of life, dry from all the entertainment of life. And then they will come up with stool which is so dry that the patient will say, stool which I had yesterday was like a pebble. Pebble came out yesterday. The tar which they used to tar the road, that type of a stone fell out yesterday. Because they are dryonia, and that is the constipation of bryonia. This is also an observation, okay? Not only of the stool, even the urine, the color of the urine will also help you to arrive at a certain diagnosis. So I remember a case, 2017. A patient of mine had gone to a neighbor's house and suddenly came up with pain, renal colic, acute renal colic. She was incapacitated. She was not even able to speak, but she dialed me and she told me this thing has happened. Then I asked her, have you passed urine? She said, yes. What color of urine? Then she told me, the urine is so dark like tea, black tea. So the side of the pain and the type of the urine helped me to decide the drug that was osmum canon. So an observation which has been conveyed on the phone can also help you to make the prescription. Understand? So another patient of mine, he was suffering from prostatitis and he was not able to pass urine. and there were no modalities. There was everything is good, everything is fine. uh, I asked him, is there any position in which you are able to pass urine with comfort? I told him, show me. So he went against the wall, he put his head against the wall, bent forward, spread his legs apart. And he told me, this position I am able to pass urine. And this position exactly is given in our Materia Medica under the drug chemophilia. Okay, so a certain posture also, which the patient demonstrated to me in the clinic, I have a photograph of it, that can also help you to make a prescription. Look at this person, okay, cranky, contrary. These are our chamomillas, right? Even the type of pain, I remember seeing a patient in 2018 who had suffered a inferior inferior wall MI, was shifted to the ICU. In fact, he was dialing me and he got the attack. Uh, he was getting the attack and he dialed my number and his phone fell down and broke into pieces. I immediately rushed to the ICU and I remember the treatment was already started, but the patient was complaining of crushing type of pain in the epigastrium. He pointed out like this. So spot pain, crushing pain, and better by diverting the mind. When I looked at this combination of symptoms, straight away it took me to the oxalic acid. So I arranged oxalic acid 200, one single dose. All the crushing pain, vanished, and patient sighed in relief. No doubt. Next day he was investigated. Angiography was done. 90% block was found. After 15 days, his bypass was done, and patient did is doing well till today. But just this expression of the pain, the site of the pain, the spot pain, can also help us to relieve the patient who is in so much of excruciating pain. To a patient who has suffered MI, and to give him relief, okay, is the biggest blessing, right? So to conclude, what I would like to say is the words of William Osler: observe, record, tabulate, communicate. Use your five senses. Learn to see, learn to hear, learn to feel, learn to smell, and know that by practice alone you can become expert. My sincere thanks goes to my teachers who taught me the art of observation. I would like to thank my patients whose trust in homeopathy honors me. I would like to thank the organizers of this webinar, the Secretary of All India Homeopathic Students and Youth Association, Dr. Arpana Parik, the National General Secretary, Dr. Lavanya Sai, the anchors, Ashika and Aditi, and a huge thanks to the person who has suggested me to the organizers, Dr. Nilima Pohame, Professor, and a huge thanks goes to my audience who spared their valuable time to participate in this webinar. Good night and God bless.
Thank you, sir. Thank you so much for the overwhelming session, sir. Respected participants, if you have any questions, so kindly comment in the comment box so that sir will be answering. Yeah.
Madam, can you read the question?
Definitely, sir.
Can I share one more experience of mine where the observation helped me to make the prescription?
Definitely, sir. We are welcome, sir.
So once I was called to see an old lady who was walking, but suddenly she was bedridden. She was restricted to the bed. So I went for a home visit. It was a rainy day. Everything was so clean in their house. Then I inquired with her. She was hardly able to sit up on the bed. It was, infective osteoarthritis of the left knee. And I was not able to get, it's such a horrible rainy weather. I'm thinking, is the weather affecting her? But it was not confirmed by the patient. I did not get any clue. As I was just about to end the consultation and the daughter went to prepare coffee for me, she started saying something is there in my throat. So immediately I put the torch and I checked, and I saw the shape of the uvula. The shape of the uvula was like a urinary bladder. And if you look in Allen's keynote, the urinary bladder like uvula you will find in Kali bichrome. So for this case, I gave Kali bichrome, and by next day I got a call that mummy is walking in the house by holding the walls, taking the support of the walls. I told, why you're worrying? Till yesterday she was fully restricted on the bed, unable to bend her knees, unable to turn in the bed, and at least she's on her foot now. And so many, for months together, she was all right, just with that one dose of Kali bicromium 200. So an observation that, gave me entry to the case, helped me to cure the case. So I just recollected this case also, where observation helped me to make the prescription and get the old lady to, walk once again. Thank you.
Thank you, sir. Sir, I have a question, sir. How about the role of hand gestures by the patient while during the role in the observation, sir?
The role of hand gestures requires the understanding of body language. Now, uh, this knowledge of body language is not known to all physicians. One needs to train oneself in that direction. One very valuable book is there of Dr. Ajit Kulkarni on body language. In addition to that, one may have to read body language as it is. Then only one will able to interpret and able to prescribe efficiently by looking at there are these closure signs, and but they are complex. If they can be interpreted accurately, exactly, then only one should go ahead, because generally what observations we are using in our prescription, these are the ones which are mentioned in our material. Let's say I remember a patient sending me a picture of the piles, and it was looking like a red cherry. So hemorrhoids like cherries. I think so. I have given LOs for that case, and that hemorrhoid became all right. So certain observation which are also given in our materia medica. If you go now, this hand gesture, this is an interpretation which you will take. If it is accurate, you will go in the right direction. If there is a if there is a gap in your understanding and the patient's meaning, like I gave the example of those consultant and the patient limping, if there is a gap, then you will be completely misguided. The same question arises for dreams, whether which type of dream we should take for the prescriptions. Because in our if you know today, dream analysis is a separate uh, chapter in itself, is a separate content in itself. But our dreams of our materia medica, they are not the interpreted dream, they are as it is. So how accurate we will be if we take, just as it is? Because dreams, most of the dreams that I have also tried to decode in my practice, they were for the understanding sake. They were not for the prescription sake. Maybe in 15 years of my practice, I have made 3 prescriptions, that to successful prescription based on dream interpretation. So same goes with the body language. So what my advice would be, instead, until and unless you have a extensive understanding of body language in terms of hand gestures, one should not venture in such an area, because there is a much risk of failing. Okay, with time our observations are time tested, so they get better and better. So maybe you put yourself in this line for a couple of years, and then you can become an expert. Then you can do it accurately, like how Dr. Ajit Kulkarni does. But all of us, we may want to be like Dr. Ajit Kulkarni, but life is always not so kind to all of us.
Thank you, sir.
I have
There is
just
a
tried to answer this.
question.
Yes, madam.
Yes, sir. There is a question from the participant, sir. One question from the participant, that how to deal with the financial criteria at the beginning of the homeopathy practice. That was their question, sir.
Who is facing financial criteria, patient or the physician?
I think they are not mentioned, sir. During the homeopathy practice, they have mentioned that. How about the pertaining to the financial problem, like in the early of their practice, how to deal with that? There,
See,
this question, sir.
in the early practice, my dear doctors, there is always a struggle, you know, because we cannot be charging thousands as young novices. It will take years to develop your skills, to develop a name, to develop your competence and your skills. Then you may charge. So initially, see, even today I'm sitting, but my consultation fees were 50 rupees when I started. So there is a finance. No good homeopath can be rich. Good homeopath. So one has to go through this uh, fire and get tested, and owe responsibility for his future, and then only you can get better. So initially there have been a lot of struggles, and I think so in struggles only we learn better, because I also have my practice in the village, it's not in the city. And with time it gets better, and then patients start coming, not only from our country, from other countries also, and the financial condition of the doctor also starts getting better. And I will be not saying this just simply to encourage you. Many of our NRI patients, they are giving a lot of presents in terms of finance, in terms of material goods, in terms of opportunities, even for further studies. So a time will come where your competence will reward you. A time will come where the society will reward you. But initially there are struggles. Even my colleagues who are still, in 15 years, still they are struggling, but they are struggling for the higher purposes of practice. Not for the local physical homeopathy, for the dynamic homeopathy, where we are working on characteristic symptoms, not just any common symptoms, where refined type of practice and consistency in the results. And that requires one mindedness. You cannot look at the finance, you cannot look at the patient as a financial patient is walking and you see money walking towards you. That should never be in your head. If this is there in your head, then you will never succeed in your practice. You should be our practice is not a business, it is a mission. So a missionary would never see how much he is having or in his pocket, or what he will gain in return. His satisfaction comes in the relief of the patient. I think if you have this in mind, with a good attitude, a reward is sure with time. It's a time tested reward. Any other question, madam?
Oh, thank you so much, sir. Sir, Am I audible, sir?
Yes, madam, you are audible, madam.
I think they are clear with the topic too, sir. Thank you, sir. Thank you
I'm
so
so
much.
thankful to you all for giving me this platform.
Our pleasure, sir. Thank you, sir. Thank you so much, everyone. Thank you, all the participants. So, we'll be back soon with the tomorrow session. So, stay tuned for the details in the social media. So, thank you all. Thank you so much.